Ladies and gentlemen, please join me in mourning the loss of His Excellency John Pombe Joseph Magufuli, the 5th President of the United Republic of Tanzania, who passed away last week. President Magufuli had a PhD in chemistry, and as the 5th President of the United Republic of Tanzania, was known for his no-nonsense approach to development. We want to recognize Tanzania today because as the founding chair of the African Leaders Malaria Alliance, the 4th President of the United Republic of Tanzania, His Excellency President Kikwete, introduced the scorecard on action and accountability and popularized it amongst fellow heads of state across the continent. We would like to share with you a video demonstrating the burden of malaria in Tanzania and the use of the scorecard as a high-level advocacy tool that has democratized amongst parliamentarians and amongst the population the use of data to inform information, policies, and decision-making. Thank you.
According to the World Health Organization, Tanzania is among 11 countries with the highest transmission of malaria. In the fight against malaria, the Tanzanian government has been taking several initiatives to make sure that malaria is eradicated by 2030. Interventions against the disease include the distribution of insecticide-treated nets, indoor residual spraying, diagnosing all patients presented with fever using rapid diagnostic tests, as well as larviciding all mosquito breeding sites. In 2019, the Comic Relief GSK partnership worked with the African Leaders Malaria Alliance to support the United Republic of Tanzania to enhance high-level advocacy and action for malaria with the use of a scorecard. It was launched by the Honorable Minister of Health in November 2019 on SODEC Malaria Day, a yearly event to create awareness of malaria in Southern Africa, and was attended by Tanzanian parliamentaries against malaria, known as TAPOMA. The Malaria Scorecard is a management tool that shows the performance of priority malaria indicators in a simple color-coded format. The scorecard is used at political level to keep malaria high on the agenda.
This scorecard will ease the whole process of accountability because it uses indicators that evaluate the situation based on evidence and give importance to the areas of underperformance.
Using the health service data being reported daily, every quarter, the National Malaria Control Program produces the Malaria Scorecard.
The subnational indicators on the scorecard can help one to gauge the performance of key interventions, such as how many pregnant women are receiving anti-malaria medicine, the distribution of bed nets to pregnant women, distribution of bed nets to children during vaccination, or one can examine the incidence of malaria within the district or look into the positivity rate of patients.
You can access the scorecard in two ways. The first way is through Scorecard web platform, which can be accessed online via a computer through a web browser. With the aim of easing the use of scorecard, we saw that it will be more appropriate and more user-friendly to make the scorecard available through smartphones.
Through the Malaria Scorecard, leaders can better support the implementation of malaria interventions and actions that address underperforming indicators. Tanzania's Parliamentary Committee Against Malaria, TAPOMA, and other high-level decision-makers were trained on how to access and use malaria data to take action.
For example, in two of my districts, Kagera municipality and the municipality of Bukoba, one can clearly see on the scorecard that it is a path we need to follow and where we need to take more action.
Through Malaria Scorecard, leaders like District Commissioner, together with District Executive Director, during our meeting, there will be discussion about the indicators. Citizens also have a big role to play, and we have been collaborating with them in the fight against malaria, especially when considering a big part of transmission of malaria goes hand in hand with the education. And so far, they have been helping in making sure that we eliminate malaria.
To achieve the goal of malaria elimination by the year 2030, there is a need for leaders to support malaria interventions in their jurisdiction and maintain malaria high on the political agenda. By using data to support the fight against malaria, a zero malaria Tanzania is possible. Zero malaria starts with you. Zero malaria starts with me. And zero malaria starts with our leaders.